Welcome to This Week in Health IT events, where we amplify great ideas with interviews from the floor. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. We want to thank our founding channel sponsors who make this content possible, Health Lyrics and VMware. If you want to be a part of our mission to develop health leaders, go to thisweekhealth.com/sponsor for more information. This episode is sponsored by Health Lyrics. When I became a CIO, I was really overwhelmed at first, and one of the first things I did was to sign a CIO coach to walk with me through the journey. This was someone who had wisdom that can only be gained through years of experience. It was invaluable to my success in the role, and I now coach CIOs through Health Lyrics. If you want to learn more, visit healthlyrics.com or drop me a note at bill@thisweekinhealthit.com. Over the next 3 weeks, we have a huge treat for you. I'm really excited about it. I just got back from the CHIME Fall Forum in Scottsdale, which was a great event, and we caught up with 12 active CIOs from various size health systems and asked them to take a look back at 2019 and a look forward at 2020. You're going to hear what they're excited to have accomplished last year and what they're looking forward to accomplish next year. I asked each of them the same 8 questions, and I think you're going to be fascinated to hear the similarities and the differences based on where they're at, geography, and other things. Each of these interviews is about 10 minutes long, so you can listen to them really quick, and some of you listen at 1.5 times speed, so it's going to go like that. We're going to publish one a day with a few Newsday episodes sprinkled in through the end of November, so check back every day for the next episode, and don't forget to look back to see if you missed any. I was excited to get a chance to sit down with James Brady. James and I have been CIOs in the same market for quite some time. James is now the CIO for the LA County Department of Health Services, and we had a very interesting conversation. Again, I appreciate when we get different perspectives and different health systems trying to accomplish different things. I learned a bunch. Hope you enjoy. Ready to go. Here we are, another session from CHIME Fall Forum. We're here with James Brady. Gosh, I'm mixing it up already. LA County Health Services.
Los Angeles County Department of Health Services.
There you go. 4 hospitals.
4 hospitals, 23 clinics, covers about 4,000 miles, population of 10 million folks, 1,900 beds, $6 billion in revenue, so it's quite a large area to cover.
Significant homeless population, and we were talking earlier that there's a lot of you take care of the people that the other health systems aren't taking care of, essentially.
Right, yeah, we are the second largest public hospital system in the country, and we are considered a safety net, although we do have folks that are about 600,000 people that are impaneled, and a number of people do choose to come to the Los Angeles County hospitals. And we're also very, very closely aligned with USC and UCLA for residency programs, and also Charles Drew nursing for their residency program also. Fantastic.
So what we're doing at the conference is a look back, look forward kind of thing. So 8 questions, asking all the CIOs the same 8 questions. There are no right or wrong answers. Every health system is so different. It's been really fascinating to listen to. The first question is, how do you think the role of the CIO has changed over the last year? Not over the last 5, but just over the last year.
Yeah, I think over the last year, definitely a more strategic thinker that can help the executives and the leaders and the boards know, hey, what do we have to do in order to achieve our mission? And so, we've watched the CIO role go from the IT guy or IT gal in the basement, into a service delivery to somebody more of, more involved in the business. But I think the role now, you really have to understand the business.
Yeah.
And at the county, we're seeing a shift now. The way we get our funding has largely been through federal waiver programs, and so those programs are leaving in 2020. So now we have to move. It's being shifted more to the state, who is going to be using managed care. So there's a lot more focus on value. So we're really concerned about how do we demonstrate value, and so that financial sustainability is one of our key initiatives. So understanding that, and how do we help lead the organization there is it's an important role for the CIO.
Phenomenal. So I mean, you probably just rattled off one of them. And
That
the
was
next
one.
Yeah, so, what are some of the priorities that your system's looking at that Health IT is looking to support over the next year?
Yeah, so I think in addition to that one, which is a big one, we're also looking to really re-engineer and optimize our workforce. And in the state or in the local government, it's important, I believe, to really invest in your employees because technology is changing, and traditionally many of the roles might have been a little bit stagnant. So it's infusing that with how can we make sure that all the employees are educated and trained to be able to do their job in the new era coming up. And secondly, it's a real focus on population health and understanding our populations, being able to care for them better, and as we shift more towards that value-based care.
Are there technology plays around? I mean, there's this. I live near your county. I live in Orange County, but near
right
your
next
county.
door.
And the homeless population in both of those counties is pretty significant. Is there anything that, from a technology perspective? I mean, I can't think of anything off the top of my head, but I was just curious if there's anything we're doing, maybe coordinating activities between different entities or those kind of things.
Between counties or?
Well, just for the homeless population.
Oh, yeah.
Because a lot of times, we'll come in and we'll go, oh, we're going to do these kinds of patient engagement things. And people will go, yeah, but what about the people who don't have phones and the people who don't? And I'm just wondering how we're applying technology to that specific problem.
Yeah, I think it's interoperability is huge. If we, those homeless folks, they do come into the EDs, they present themselves, they'll have a problem, and we may admit them, and then they get discharged, and oftentimes we have to, they don't have any place to go, so we'll get a transport and we'll take them back to where they came from. But it's really looking, using technology to document and then making that available to others. And there's a huge amount of behavioral health and mental health issues with our homeless. I mean, they're kind of in that situation because they've got really tough things going on. So not having access to that information and then being able to take them to other sites of care such as post-acute or rehab or mental health, things like that. That's where they're going to get help. And we're actually looking at healthcare now. Health, let's just get people healthy, and then also care. Let's care for people with housing and education. So it's more of a whole person care. Matter of fact, there's a federal program called Whole Person Care that gives millions of dollars to many of the counties and states, to work with people to go past the healthcare component and help them get back up on their feet again.
So we've been asking this question, sort of a two-part question, but it's an initiative that's improving the patient experience and an initiative that's improving the clinician experience. And we're just asking people, what are examples of just one on the patient side and one on the clinician side?
Yeah, so probably on the patient side, I think if we can get to Amazon and healthcare where there's just one click, and I think that's Jeff Bezos, that's one of his goals. Where it's really self-service, where you have a need for something, you're able to go digitally and get to that. I mean, if you need to come in and see somebody, fine. But if we can use the digital, it would be so much better. Convenience, not having to go, leave work, grab your kids, drive on the freeway, wait in the waiting room. Why do we call them waiting rooms anyway? But being able to go ahead and do that digitally. So really engaging in the patient experience, I think, is something where it's important. On the clinician side, we've got to be able to get our physicians untethered from the keyboard and data entry. So that's going to be using artificial intelligence, machine learning, natural language processing. There's a lot of advances now with voice, so that you can just have a natural, fluid interaction and have all that documented and available, rather than you're typing and you're turning back and forth to the patient. So it's a little bit awkward. It slows things down, and physician burnout is a big issue at this point. A lot of it is because docs are having to just do, and providers are just having to do a lot more manual things that hopefully one day in the future, not too far, we'll be able to get past that.
It's interesting as you're talking about that. It's like the object is to make it easier for the patients. The object for the clinicians is to make it easier for the clinicians.
That's supposed to have been the goal.
Yes.
Unfortunately, most statistics and research indicate that physicians, it costs more to use an electronic health record than they were prior when they're on paper, and then they spend more time documenting and taking care of of the administrative stuff now that they have an electronic health record. So it's definitely been an issue, and there's plenty of research out on it, and that's why we have a high physician suicide rate in the country, at least in the U.S. So it's a problem, and I think the answer is going to be that human-computer interaction where it's going to be more natural, but it's going to take us a while to get there.
Yeah, the computer with ambient listening, you're almost going to have the computer being a scribe, which will be interesting. What's your greatest IT success for 2019 for your team? What are you most proud of?
Yeah, I think I came to the Los Angeles County Department of Health Services in January, and the organization is traditionally the genesis was a number of separate acute care hospitals and clinics kind of all came together. So we did implement in 2012 a electronic health record through Cerner, but in many ways, although we operate as an integrated system, we're still moving in that direction. So I think from my perspective, one of the things that I've been working with our senior IT leadership is to how do you get all of those CIOs to come together and be one team, sort of like the Patriots before their last loss, but a cohesive team where we still take care of our hospitals, but at the same time, our focus is on the enterprise and it's on the system. So I think it's just getting that top level leadership to buy into that, and then we're making changes where we're, working and meeting together and operating more as a cohesive team in order to. The goal would be to continue to drive towards an integrated, fully integrated system.
Yeah, that's a challenge. I've been asking this next question as what's a missed opportunity for 2019, and I'm not getting the answer I expected, so I'm going to change it a little bit.
I'll be happy to answer that.
But really, what I'm trying to focus in on is what do you wish you had more time to spend on over the last year that you just didn't get to because there's just so many other things going on?
Right, so I'm going to answer both questions, thankfully, because they dovetails great. Data is such a huge, important area in healthcare, and if the data doesn't go in properly, then you can't really get the reports, you can't get the outcomes that you need from the data. So with the electronic health record, and the focus for us in the county is getting it in, really have we optimized it, and then are we really making sure that the data is something that we understand. And so many physicians really were not taught to code properly, and so rather than going back 10 years and trying to teach physicians how to code, can we use some of these more advanced tools, physician-aided physician coding and chart assisting and things like that. So I wish there was more time and focus to be able to understand what's in the market and then being able to implement it so that we could get a better idea of our data, because as I mentioned earlier, our revenue moving forward in public hospitals in the country, particularly in California, is not going to be given to us through federal grants and waiver programs, but it's really going to be through health plans and demonstrating value. So we really need that data.
Right.
And then, of course,
to prove the value.
The most important thing is to be able to care for patients. And if you don't have the right data, then you can't really care for patients properly.
Right. What's one area you'd love to see more innovation that, if you were able to just turn the key and say, we're going to really have a lot of progress, we're going to move the needle in one area, what would it be?
Yeah, I think the biggest one, and this may have been said by others that have sat in this noble chair, is the EHR is really just a conversion from a paper chart to a digital chart, but it's not intuitive. There's too much typing, there's too many things on the field, too many little boxes. You need a giant monitor in order to use it. But how can we, it goes back to my other comment, how can we change that clinician to computer interface? And so I've heard some stories somewhere in Asia, they've got a new EHR construct where it doesn't look anything like what we've got here. It's more of just a picture of an individual's body, and you just kind of point and click and you talk to it, and it's completely different than what we're doing right now, which is we're still tied ball and chain to that fields, discrete fields, and it's very time consuming and it's not natural. It's not, I mean, we talk much faster than we can write, and we think way faster than we talk. So I think it's kind of moving in that direction with the EHR and how we document care and during encounters.
Yeah, so one of the things we've learned from surveying our audience is we have a bunch of college students watching this show, and it's fascinating to me that they are, and I think it's because healthcare is an area that this next generation really wants to invest their time.
Can I make a comment about that?
Sure.
All right. Yeah, so to all you college students out there, Generation Z and maybe some millennials that are getting a late start.
Millennials are pretty old now.
Yeah, so we need you. There's a lot of research that is demonstrating or indicating that a large percentage of the workforce moving forward will be you guys. You guys have the great ideas, and if you have any passion for working for public service, go ahead and follow those passions, because we got a lot of need in our public hospitals and clinics.
So the question they're asking is, what roles is health IT? And we'll just focus on 2020. What roles do you think you're going to be hiring in 2020, and maybe even beyond, that they should be focusing in on?
Well, definitely not COBOL and mainframe.
Yeah, although it still exists in some places, but
actually that might be a good job security to get those things, because they may never leave. No, I would say analytics, data, artificial intelligence, coding, particularly data scientist roles. Being able to code with modern, cloud-based techniques. Those are things that I understand are good. They have a good pay scale for, and what we used to do 2 or 3 years ago really isn't that relevant now. It's really moving forward into these new areas.
And that goes back to our first question: how's the role of the CIO changed? And to this next generation, they're going to have to reinvent themselves 3 or 4 times over their lifetime. Because just in the decade or so I've been following the healthcare CIO role, it's dramatically changed. I mean, the things you used to have to be good with technology and understand like the infrastructure and that kind of stuff. Then you had to be really good at organizational change management and do that EHR. And now it's forward-looking technologies, cloud, ambient listening, and that kind of stuff. And that's just a decade. I'm seeing CIOs have to reinvent themselves multiple times. This next generation is I'm probably being kind and saying 3 or 4 times in your career, you're going to have to just keep changing.
Yeah, we're seeing a lot of new physicians that very technically savvy. They're like, "What are you guys doing? I can't believe it." So the expectation from them is, they grew up with Facebook and social media and mobile devices. So I think we need to continue to drive towards mobility and ease and of access. And then just one final comment is, I think the CIO, it's important to be able to partner well with the other senior executives that lead the organization. There's lots of different personalities in these organizations. So, can you get along with all of them? Can you help support and supplement and bring people together? So I think that's an important.
It's a team sport.
Quality.
James, thank you.
Thank you so much.
Appreciate your time.
Appreciate it. Thank you, guys.
I hope you enjoyed the conversation. Remember to check back often, as we are going to drop an episode a day for most of November of 2019. Following that, please come back every Friday for more great interviews with influencers, and don't forget, every Tuesday we take a look at the news which impacts health IT. If you want to support the fastest growing podcast in the health IT space, here's a few ways that you can do that. The first, share it with a peer, share it with a friend, share it with somebody who's working right there next to you. Number 2, sign up for Insights and Staff Meeting. These are services designed to help you in your career. Number 3, interact with our social media content on Twitter and LinkedIn. Number 4, post or repost our content. And number 5, always send me feedback, bill@thisweekinhealthit.com. Your insights continue to shape the channel. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or our YouTube channel. Special thanks to our sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Thanks for listening. That's all for now.